Okay, so it's actually somehow became my immense pleasure, and Clarion's been very generous to allow me to do this because I will be introducing our last speaker, and it's Mr. Michael Myers, the Managing Director of the Rockefeller Foundation.
Thank you, Kathy, and thank you to everyone for your strong and vigorous participation in this over the last 2 days. And a number of you have traveled from distant places, so it's been quite an investment in time and effort to get here and to participate as you have. I want to thank Victor Zhao and the whole team at the Institute of Medicine for putting together a fantastic assembly, a fantastic forum, and I think we should give them all a hand for what they've done. I think for the Rockefeller Foundation, this has more than exceeded our expectations, so thank you for that. And then Clarion, where's Clarion? There's Clarion Johnson, keeping us on track the last few days, leading the committee. Thanks so much to you and to the committee members for all you've done to pull together the agenda and to move things forward over the last few days.
Thank you for your support.
You're welcome. You're welcome. For the camera, he just thanked us for our support. So that I know this is the end of 2 very long and intense days, so I don't want to lay anything too heavy on this audience at this hour. But let me, if I may, just tell you a little bit about the journey of the Rockefeller Foundation that gets us to this point and to this room, and then some notion of how we as one actor from around this table are thinking of proceeding on this particular question. So when the Rockefeller Foundation first opened its doors, this is May of 1913, on the very first day that people sat down at their desks, the first issue that the Rockefeller Foundation dealt with was health. And we've dealt with health issues every day for the 101 years now since that moment. We were able to participate, had the honor to participate in building up the field of public health. And within a few years, or a couple of years of our founding, we helped establish the Johns Hopkins School of Public Health to further that field, and other schools around the world to train people to build up health systems, Kathy, and to build up public health systems as well, to further the health needs of people across the planet. So we're proud of that engagement and our role in building up what at that point was a very fledgling field. We've been engaged in the science of health, and so Rockefeller, at one point we had labs in our offices with scientists on our payroll who came up with vaccines for yellow fever, who worked with others to identify penicillin, and these were Nobel Prize winning endeavors. We've had, between us and our grantees over the last century, we've achieved more than 200 Nobel Prizes for the work that the Rockefeller Foundation is responsible for. We've been involved, in addition to the sciences, in tackling with you, many of you, specific diseases around the world. Not just the vaccines for yellow fever, but in more recent times, the battle against HIV/AIDS. And that we've done together. That led us, in the last couple of decades, to focus on health systems and building up health systems. And the transforming health systems is what we call this particular initiative. And we work with many around this table on that effort, working with specific countries on some of the nitty-gritty nuts and bolts of building up a national health system. Through that, we've been part of creating a joint learning network that now has 9 countries where there's peer-to-peer learning and sharing over things like costing manuals and financing schemes and all of the stuff of building up a national healthcare system. But we realized that's not enough. Setting up a health system, as good as it can be, is not enough, and because we have to deal with questions of equity along the way. How do these systems reach everyone in a country? Everyone in the world. And that leads us to the question of universal health coverage. So that is our march, our journey, if you will, over the last century that leads us to this question of universal health coverage and has caused us to join in the campaign for universal health coverage to be one of the post-2015 goals for the planet. It's that important. The equity questions are so pressing that that's a necessary step in our progress. Well, if we're going to achieve universal health coverage, that means everybody, right? So what about informal populations? So that is the latest question among many that we've been grappling with as we proceed forward to promote universal health coverage. So for the past couple of years, we've been looking at this question and trying to understand it more, realizing that in many ways, people in informal communities make up the majority. So it's not, one way of looking at it is that it's a last mile question, but if you're talking about the majority of a country, a mile is not the right metric for that, speaking of the need for metrics. So we're now rolling up our sleeves with you to figure out, well, what can we do that connects people in informal communities, informal populations, informal workers with the formal health system? How can we make that health system work for them as well? So those are the burning questions of today as we continue to push forward for universal health coverage. How do we accomplish that goal? Now, we first started thinking about informal workers as workers. What is it about them as workers? And that kind of led us to some interesting questions, but didn't guide us toward fuller thinking and fuller solutions. It was only when we stepped back a bit and started thinking of informal workers as people that possibilities began to open up, at least in our thinking. And I'm so thrilled that in the last 2 days in this discussion that focus has been on the table as well. Because when we start thinking of them as people, like you and me, then we recognize, well, these are people who have aspirations. These are people who are highly networked. They have to be to survive. These are people who are entrepreneurial. These are people who have dreams and try to do things for their families. These are people who have places where they congregate and enjoy each other's company. So when we started realizing this about this population, then we thought about, well, if we're looking at meeting health needs, we're not isolated to thinking about what we can do in the workplace or at a clinic, but what can we do for people in that marketplace in Durban where there was the fire that was described earlier? As people are crisscrossing that market, largely informal workers and their families, are there possibilities there in that place that we can take, move forward, and advance the health of this population? So that kind of leads to some muddled thinking, perhaps, of a possible approach that we at the Rockefeller Foundation are thinking about that's reinforced by a lot of what was discussed around this table over the last 2 days, which is there's a lot of stuff, there are a lot of things going on now that are fantastic. We've heard them, whether it's self-help groups, community groups of women, whether it's technology solutions, whether it's things that health ministries are trying to do, all of that's going on now. So maybe, just maybe, there are creative ways of stitching those elements together in new and creative ways to achieve even greater impact for informal workers, informal communities. We've done a lot of work at the Rockefeller Foundation thinking through, well, what is innovation? And I know when most of us hear that word, we think of, the next iPhone is an innovation, and in a way, it is. There's product innovation is a very important kind of innovation, but we realize that there are other forms of innovation that can be innovation in the way we organize our organizations. But a big way of that innovation occurs is a kind of recombinant innovation, where we take existing elements and recombine them into new and more effective ways that give greater power, greater results to what we're doing. So that's what we're exploring now when it comes to informal workers. You can imagine that market in Durban where you have a trusted local organization working with the people who work in the market, the customers who come through that market by the thousands every day, a trusted local organization that people in that market listen to. You can imagine that they would be trained to convey health information that is of value to that population. You can imagine that the people themselves view their own health as an asset, because without good health, they don't have a livelihood. You can imagine that there's a cell phone company that's looking for business, and I know there are some, looking for business among informal populations that might be willing to add some element to its mobile platform that helps stitch together that community. And you could imagine using the persuasive powers of people around this table to get the health ministry to locate a clinic nearby that marketplace, so that because people don't have the time to go to clinics, they need the services to come to them rather than them to the services. So you can imagine that recombination of existing elements in these creative ways to be a possible model, if it works, that we could try to replicate in different parts of the world to help us solve this last mile question for universal health coverage. So that's what I find so encouraging about this conversation today. We're moving forward to explore this particular model that I just described. Maybe it works, maybe it doesn't, I don't know. It's a scary proposition. But with the help of people here and elsewhere, we're looking into that, using much of what you said here in the last 2 days to inform those actions and the steps that need to be taken. Let me say lastly that I learned many things from this, but one that I just want to close with is that the importance I feel from this discussion of not only doing what I just described as kind of local level, that engages local people in co-creating solutions to their problems, but connecting it to the higher policy questions at the same time. And so as we look at these local approaches, and we've heard some in the discussions here today, it's my commitment at least that as we do that at Rockefeller, we also will want to look at the big policy plays that are necessary to make it effective and sustainable going forward. So I'll close with yet another word of thanks to everyone here, and for your commitment of time, of intellect, of your life's commitment in many cases to what is a very important issue and challenge for all of us into the future, and one that we at Rockefeller wholeheartedly embrace. Thank you very much.